Hey, this is Dre with Yourself.Podcast. We hope we're finding you all well during this holiday season. And welcome to the podcast today. Today's guest is Melissa, and she will be discussing how her coping skills help her with her profession. We'd like to welcome you, Melissa, and happy
Thank you.
holidays, Merry Christmas, all of that. You look awesome tonight. Thank you so much for helping us out.
Thank you. Yeah, I appreciate you.
I just wanted to ask if you could give us like a little rundown, a little rundown of what you do for a living.
So I work for Rocky Mountain Cancer Center and oncology, and my title is a patient service representative, but I'm actually the scheduler. So what I do is, and I'll give you an example. The best example is for new patients. New patient comes in and they've been they've already been diagnosed before they see us.
Okay.
And there's a whole bunch of things that these patients have to do, like before if they choose if they choose chemo. There's like an echocardiogram, PET scan, um, MRI, and oncology or radiation oncology consults. Most of the time, cardiology. There's all these things they have to do, plus a chemo teach. All these things have to line up, and it has to line up very fast because we don't want to delay treatment. My doctors, specifically, I work for two oncology doctors and one hematologist, and my doctors want to start chemo within a week,
Okay.
and I'm not responsible for lining up all these scans or consults,
Okay.
but I need to, because those little frail humans are sitting at my desk. They just walked out of their oncology office visit and they're crying and their family's with them. And they're like, well, we got to call this. We got to call this. And I'm like, no, you don't. I'm going to do it for you. You're going to go home and eat dinner, hold each other. And I'm going to let you know that I've got everything scheduled within 3 days so that we can start chemo next Wednesday.
So you're like the
Um,
forefront right after they've been diagnosed with cancer?
yeah, yeah. They
Okay.
see the doctor, um, and they go through that whole thing, and it's just a lot. It's a lot to process those visits, um, because they're sitting with the doctor, and people are so scared of chemo and what it will do to them. So my thing and I've been through that, where we're waiting for somebody to call us about a CT scan or a PET scan, and it's like time crunching, and
Right.
um, I just put it upon myself where I'm like, I started to make connections with people in other clinics where we do that, where we would send those orders to,
Mm-hmm.
and I just started coordinating with them and like, okay, we're starting chemo in 1 week. I need to get all this stuff done, and I don't want those poor patients to have to like go home and worry about phone calls and scheduling. Let me take care of it. Let me know if you have days that you can't do something. But half the time, more than half the time, these patients are like, everything else in life is canceled. This is priority. So,
Okay.
um, and it's very much appreciated because they do get to go home and relax and be like, as best they can relax,
Right. Yeah.
and be like, well, Melissa's got this, you
Right.
know?
Got it. So
Yeah.
you do basically, you mentioned you take care of everything for the patients. They've gotten the news, which I'm assuming is very overwhelming and shocking. Like you said, a lot to process.
Yeah.
So, um, like day to day, I mean, is it like, are you rushed? Not rushed, but I guess I would say, do you have patients that are listed 1 o'clock, 2 o'clock, 3 o'clock, and you have to date and you have to face that, or are the appointments more spread out? Do you have time?
So
Do you personally have time to like be able to process with them and to then gather all the info that they're going to need?
so I do because like what we were just talking about just a second ago, that would be considered a new patient for us. And I'm going to just use one doctor's clinic as an example. We see up to 4 new patients a day.
Okay.
And not every single one of those new patients have to have that serious workup before chemo. And some don't need chemo. Some are high risk patients that um, just need to follow up 6 months or annually. But everybody else, once they've established and they're going,
Mm-hmm.
I schedule their chemo sessions with office visits months in advance. So I have a patient I scheduled today all the way through July
Oh,
to
okay.
her end of treatment. So once again, there's no stress there that, if a ride or something can happen. But um, if my one physician sees 4 new patients a day, and there has been cases where I've had to do that 4 times in one day, it is super stressful. And sometimes I can't perform the magic, especially this time of year, because end of year deductibles, people are like
Mm,
overbooked vacations and doctors are gone, and
right.
but yeah.
So, in our conversation before the podcast today, you had mentioned that you had experienced this with a friend of or your best friend, your mom.
Yeah.
How do you think that your experiences with them um, help you kind of shape the way you help the patients that are coming in to your
I
office?
feel I feel they're with me. I
Mm-hmm.
feel they're with me. And if it wasn't for finding the love of my life, Andy, here in Colorado, I worked in family practice in Chicago for 20 plus years. And I absolutely loved that job because I loved the doctors I worked with. But after seeing my mom's care at her oncology
Mm-hmm.
clinic, and then also like the kind of questions like, well, why wouldn't somebody just schedule the CT scan for her? Like, why does she have to do that herself when she just had 8 hours of chemo?
Mm.
Like, she doesn't feel good. Like, it so it's like half and half. It's like some things made sense to me and some things didn't. um and that's, I want to do like work there so I can like change it. um and like with Stacy, my mom passed away from breast cancer, and Stacy had brain cancer, and she was 35.
My goodness.
And then Andy's dad, his case was just the strangest fucking thing in the world. It wasn't the cancer that killed him, it was the immunotherapy.
And can you explain what that is?
So he had 3 rounds of chemotherapy, and he was going to have, I think, 6 rounds of immunotherapy. Um, immunotherapy is like a form of chemo, and I'm not medical, like I don't understand like the jargon,
Mm-hmm.
but it's something that's done after chemo. It kind of builds obviously the immune system up, but
Okay.
it's pumped with it is pumped with stuff.
Mm-hmm.
And I think he had one treatment and it just
It was too
his body
much.
was just like, I don't like you and goodbye. And all these things, obviously Andy's dad's situation was after I moved here, but my mom and Stacy, I was there for 90% of their visits,
Mm-hmm.
and it just, I saw like the beauty in it and the flaws, and I wanted to be part of the beauty, and I wanted to fix the flaws that I knew as a caretaker could fix, or not fix, but help expedite.
Mm-hmm.
Yeah.
And how do you I assume that, because you work so closely with your patients, and you're
Yeah,
trying to do all the scheduling, you get to know these people on a
I sure
one-on-one
do.
basis. So, how do you process it if, like you mentioned, sometimes their body rejects the neurotherapy, like you said, or
Mhm.
or even the chemo, and if they pass away suddenly, their body just shuts down to it. How do you process that grief after you've gotten to know that patient?
I mean, every patient has been different. I mean, there's been some that have come home to and have absolutely just sobbed like it was a family member. Um, but then, like, seeing some patients that have just been fighting so hard and so long, and then they just get tired.
Mm-hmm.
And then it's like almost, and I hate to use the word refreshing, but it's like you're not in pain anymore. And there's a variety of patients that some are witty as hell. I have one patient, she's like, can I just die already?
Oh my goodness.
But she keeps coming every damn week. And like, Michelle, just come on in. Just come for your social visit. And that's another thing is patients like develop these relationships in infusion because it's this massive room with all these chairs, and
Right.
if people are on these same regimens, they see each other every week or every 3 weeks, and they develop little, we call it chemo cults.
Chemicals.
So chemo cults. And and when one of them is having a bad day or a bad week, these humans just huddle together and they support each other back there. And about 40% of my patients have my actual cell phone number,
Mm.
and they'll text me and be like, come back to infusion, Michelle's having a breakdown. I'm like, oh shit, and it feels like me being as active as I am in their care as being non-medical. I can't medically do anything, but I can give you less stress during your cancer journey.
Mm.
If cancer journey is such a thing, but
Right.
and when I lose somebody, um it hurts really really fucking bad
Yeah.
because you get to know their family and stuff, and yeah.
That's very understandable, and it sounds like you take a lot of um, a lot of the pressure onto yourself, as opposed to, leaving it to the patient or the patient's family while they're just learning that they've got cancer,
Yeah.
or their cancer has advanced, or anything like that. And
Yeah.
so you just come home and kind of release that. That's,
Yeah. I
you
come
have
home
to.
and Andy, I have a great partner and I have a pretty awesome damn dog. And she's staring at me right now. She sees me. I'm okay, baby. Um, and I really only, and like when I come home from work, me and Andy like spend an hour just hanging out and we talk about our day and, and good day, bad day. And if I'm having a really bad day, I he knows ahead of time and he lets me cry if I talk about a patient. And 90% of the time, if there's a patient that I'm super close to, I've been talking about that person for as long as I've known them.
Mm-hmm.
So he's on that journey with me. So, and there's been a couple cases where um, really young women have passed with young children, um, and it hurt really bad. And then there's some that also just kicked its ass, and
Yeah, yeah.
and Andy is my support,
Your kind of
and
backbone.
Andy's mom too, you know.
Yeah. So, um, sometimes I know I've noticed this with even just the podcast itself. Sometimes we get triggered, with certain things.
Yeah.
And what do you think um, healing looks like for you when you've been triggered by yet another death, or another person that you come in contact with that has cancer, that has advanced and then just passes away? What do you think in the future, in working in such an emotional field? Um, what do you think a coping skill would be to help that family out?
To help the family out, what I've noticed is a lot of the families, and I'll start with like the younger patients that have passed is they do like memorials and they invite us and stuff, but they come and visit us all the time. And I always thought that was kind of weird because it was like, this is a place where your mom was really sick,
Mm-hmm.
but this was also the place where your mom had like so much love. And like chemo is not like the scary place. It's a scary thing, but we make it not scary while you're doing it, if that makes sense. And there's a lot of support groups, and our social worker is very active with the families while they're going through things, and when if the patient passes.
Mm-hmm.
And as far as me, um, I just kind of like in my head, in my heart, I talk to my mom, and and I call my sisters when they're not being biatches.
So you do have some kind of support system
I
outside of,
do.
okay.
And my mother's childhood best friend, we call her Mama Joe, and she's literally like our biological aunt. She's actually come to see us in Colorado twice. She picks me up from the airport whenever I go to Chicago. I stay with her. She's a lifeline. Um, if I don't know what I would do without her. And I call her when I've had a bad day at work because she's been through a lot of the tragedy. Like Andy lost his dad and that's it. Like I've lost so many people to cancer in my life that you know.
It's pretty amazing that, I mean, we all know, like I have a friend who was diagnosed with breast cancer about 2 years ago, and she went through before she went through chemo, they found another tumor that was going to be fatal, and that
Mm-hmm.
they were like, this is, there's nothing we're going to be able to do if we can't take this out, if we can't
Yeah.
minimize it, if we can't, get to it, we're preparing you for the end here.
Mm-hmm.
And she's been one of my closer friends here. And so it's interesting that this particular disease takes the lives of so many, but yet at the same time it seems kind of like almost like a Russian roulette sort of disease, because
Yeah.
my friend, they were able to get to that fatal tumor, and they were able to, um, well, I don't know the medical terms for it, but I know that they were able to get to it and heal it or shrink it or get it out through chemo. And she's like living her best life now.
Yeah.
And so, and I when she was going through it, I thought about her family. She has three kids, two in high school, which are twins, and then a son who's in college, and her husband. And I when I found out the news, she told me personally she didn't want me to hear it from anybody else, and I literally just broke down in tears, just by reading the text. And I guess, and then I have an aunt who actually passed away soon after my mom did, from breast cancer, and it's just, it's like I said, it's like a Russian roulette, and I
It
just,
really is.
it's just like hit or miss, and it seems like if it's your time, it's your time, and no matter what procedures they go through, it might end up in a fatal one. And I just wanted to ask you, with all the experience that you've had, with all the work field experience that you've had, and then with the actual personal relationships, your friend's name was Stacy.
Mm.
And you mentioned Andy's dad and your mom. If they could see how you take care of the patients now in your life, and that you're working so closely, what do you think that they would say?
Very proud. And maybe doing a little too much, but very proud. I know my Stacy's probably like, you need to go work back at the bar and have some fun. But I know they're very proud. I'm motivated by them.
Yeah.
They're with me every day, and I I have pictures of especially all three of them, my father-in-law Stacy and my mom, and then like I don't try to like promote it to be like, oh, those are beautiful pictures. Is that your dad or your mom? They're kind of small and in the corner, but it's just something that I can look at because I have a very big um, artistic desk, cubicle, if you will,
Okay.
which is another thing that people liked about me was my area distracted them because they'll sit down and like, what the fuck is going on here? It's like there's like sharks, there's like art.
Yes.
I've got TikTok artist art up. I've got like knickknack gifts from patients. I've got it's just so it's like I feel the love everywhere with that.
I'm sure
And I
that
look around and it kind of gives me the you know gotcha mom. Yeah.
well, I'm sure that your mom and Andy's dad and your best friend are very, very proud of you, and I believe that their spirit lives on through you, and it shows with your compassion and your empathy. Even in this interview, I can tell that you have so much of that to give, and I really am grateful that you have given us your time today to explain all of that and to kind of explain from the healthcare point of view with a person who really does care, because it's so difficult nowadays, it seems, especially where I live in the Las Vegas area.
Mm.
The medical field doesn't seem to be such an empathetic avenue, and
Right.
it's so it's remarkable to me that you have so much empathy and so much compassion for the patients that you deal with, the people that have been in your life that you've lost. Um, that takes a lot of courage. It takes a lot of strength and resilience. And I am, to be honest, I am very proud to know you. And for someone who, I didn't lose my mom to cancer. I lost her to heart issues. She had a she had several heart attacks and had open
Mm.
heart surgery, and that was 20 years ago. And I think about her every day, and
Yeah.
I'm sure you think about your. There's not a moment in your day, I'm sure, that doesn't go by that you don't think about your mom or your father-in-law or your friend Stacy, and I just applaud you for the work that you do and for the closeness that you bring to these people who are in desperate need of it at their most vulnerable time in life.
Yeah.
And yeah,
Thank you. It's not it's just not hard for me in this part of my life. And when I knew I was moving to Colorado, I seeked out this job specifically. So it was meant to be. Meant to be. And the manager got COVID when after our interview, so she didn't call me back for 2 weeks, and I was freaking out. And I'm like, I'm gonna work in Walmart because I have to have a job in Colorado. And then Andy's like, just email her, see what's up. And then she's like, oh my God, I'm so sorry. It's my first day back. I had COVID.
oh,
Let's do the second interview with the doctor. And then I did the interview with the doctor, and they called me 5 minutes after that. And there we go.
it was certainly meant to
So
be then.
meant to be. It was meant to be, Ma.
Well, that's great. I really appreciate your time today, Melissa. I
I
want to thank
appreciate you.
I want to thank you for showing us that there are still people who care about the people that really need vulnerability and compassion and empathy, especially in this world today.
Yeah, for real. Yeah.
Thank you so much.
Goddamn right, Dre.
Well, thank you so much again.
All
And
right.
I look forward to speaking with you sometime
Yeah.
after.
Anytime.
All right. You have a great
All
night.
right.
Thank you.
You too. Love you.
Bye bye.
Bye.
Well, we want to thank everybody for tuning in and watching this spectacular episode of Melissa. Um, she is a remarkable person. I have known her for quite some time through online relationships, through social media, and I've gotten to know her. And like I said, she does a remarkable job for remarkable people, and I don't believe that too many people would be able to handle the job that she has, and in the manner that she does. And like I said, she's resilient. We'd like to thank all of you who tune in. Please catch up on all of our episodes. Please subscribe. As you know, the more subscribers we get, the more the word gets out that we exist. Yourself.Podcast. You can follow us on TikTok and on Instagram and here on YouTube. Tune in anytime. And if you'd like to be a guest, please email us at braceyourmentalhealth@gmail.com or DM us on TikTok or Instagram with braceyourself.podcast. We'd love to hear from you. We'd love to hear your story and share it with the world so that others can understand what you are going through, and that you're not alone. And we are here for your ear, lending ear for you. And as for now, that's a wrap.